Hi, this is Delegate Patrick Hope coming to you with a Week 5 update from the Virginia General Assembly here in Richmond. Tuesday marked the crossover day, which is a historic midway point where all the bills that passed the House will go over to the Senate, and all the bills that passed the Senate will come over to the House for us to deal with. Also this week is the weeks that both the House and the Senate deal with their budgets. Yesterday, Thursday, the House passed its budget, House Bill 1500. I opposed the budget, and I want to tell you why. The House bill has significant amounts of money for transportation, but it does it at the expense of cutting public education and human services. I strongly support funding for transportation and roads, but I won't do it at the expense of taking money from school kids and mental health services. For number one, it makes significant drastic cuts in education to the tune of $100 million, which I strongly oppose. It also makes significant cuts in mental health services for kids for kids and adolescents with mental health issues. It's by shifting dollars over the Comprehensive Services Plan and imposing an unfunded mandate on localities. It also has provisions in there that cuts our healthcare providers, our doctors, our hospitals, and our nursing homes. Last year, these providers were getting paid 72 cents on the dollar through Medicaid. Under this budget, physicians in hospitals will be paid 60 cents on the dollar. What will this mean? This will mean a reduction in access. Doctors will stop taking new Medicaid patients or just stop taking Medicaid patients altogether. Hospitals, what we've seen over the years, have closed obstetric wings just so they can keep the rest of the hospital afloat because they can't afford to keep their doors open. The budget also contains costly cuts in community-based services, cuts to respite hours for families who are dealing with children with mental disabilities, and the cuts to reimbursement, the salaries for the people who actually work in the group homes to provide care, cuts them by over 5%. And this makes it harder and harder to keep good employees to work for people with disabilities. Now I will say this, the House bill did contain some good things, and one of the things that I'm proud to support, and support very strongly, is the intellectual disability waiver slots that it puts online. It puts over 300 waiver slots, online right away, which I support greatly. But on balance, I can't support putting waiver slots online and then while at the same time cutting services in the community. On top of that, the Department of Justice is investigating Virginia for its services. And they're going to be looking at how much we're taking money away from institutional care and putting in community-based services. And I'm quite certain they won't be pleased with the budget that we've passed that takes funding away from the community. I look forward to looking at the Department of Justice report when it comes out, and I will comment on it, but we know what it's going to say. It's going to say that we are too lacking in our community services, and it is unconstitutional the way we treat people with disabilities. Well, that concludes this week 5 of the updates for the Virginia General Assembly here in Richmond. To continue to follow my progress and progress on the budget, please visit my website at hopeforvirginia.org. And thank you for watching, and I'll see you next week.